All right, if you're using multiple monitors, I am sharing my screen right now. Well, good morning, everyone. Welcome to the Fall Quarterly HILT meeting, November 7th, 2024. We're going to open it up here by introducing Wendy Price, who's our HILT captain with Seattle Children's. Wendy, I'm passing it over to you. And I see Wendy is on. However, I don't see her mute button off just yet. So we'll give a little bit of time for Wendy to kind of get acclimated into the meeting. And we'll have Wendy join us for conversation. Well, I will take over the place for Wendy right now. Welcome everyone to the HILT meeting. We're excited for you to be here. I think initially we were going to open up a little bit of a dialogue, understanding this week has been a bit stressful for everyone, with politics and all the things kind of happening peripherally and even directly with us. And so I'm going to move this meeting over a little bit to Ryan. Ryan has a few opening comments for everyone this morning.
Yeah, thanks, James. I think we would be remiss if we did not at least acknowledge at the start of the meeting that Tuesday and Wednesday were rough days for a lot of us, and that particularly as a network that's really centered on equity, some of the worries that we have post-election have impacted a lot of us, and I think. I just want to acknowledge that at the outset. Usually, as for those of you that have been with HILT for a while, these meetings are exceptionally energetic and engaging, and people are trading ideas, and I think everyone leaves the meetings with like this. I think everyone leaves meetings having met somebody new or making a connection. But I want to acknowledge that we may not all be in that space today. That we might just be in a passive spot right now, and that is okay, right? That if all we're today, if all we can do is muster being able to be here at the table, and being able to absorb some of the great information that we're going to get today, that is completely okay. I also think that HILT as a network, and particularly, is also a place where where we can find people that are part of our work support system. So hoping that everybody is able to, if needed, to be able to connect with somebody today. Maybe it's somebody you haven't connected with for a bit, or somebody that's a longtime colleague that's been connected here, to be able to help us through this time. So that space to engage wherever you feel comfortable engaging. I want to make sure we're all taking care of ourselves, and the folks that work for us. That wellness right now is really, really important. And I guess the last thing that I will leave is that this every time I come to HILT, I just leave with like this renewed sense of hope. And while right now hope may seem to be in short supply, this table, this network, this group of people never ceases to amaze me about the hope that we provide. Hope that we provide to our patients through the care that's given, hope that we provide to new workers in healthcare, hope that we provide to hundreds of high school students that are eager to be, to join our workforce, and that come from communities that have never had those opportunities before. Now more than ever, the work that we do with hope is more important. So my message would be, let's keep our hope. We're going to keep the work going forward. I'm proud to serve with each and every one of you, and I look forward to a great meeting today. So thank you so much, and thank you for being here today. James.
Great. Thank you, Ryan, for those opening remarks. So we will be passing this back over to Wendy. Wendy, I saw that you were back on. Can you hear us okay? Okay, I saw her, and then she might have just went off again. I did get a message that she was having some technical issues moving forward. So we're going to go ahead and move on and describe the HILT purpose and vision. We are a network of diverse and small and large healthcare providers in King, Snohomish, and Pierce counties. We come together to take action on improving access to a skilled healthcare workforce. And our vision is, since the launch of May 2018, we're a little over 6 years old. We've been here to improve equity and diversity in the region's healthcare workforce, and really work on a set of guiding principles that works with all of our HILT committees and all the work that we do. With today's meeting, we do have a full agenda here. We have a featured presentation by SBCTC. We want to thank them for coming and supporting this meeting and this presentation. Thank you very much to Travis and Summer. And we're going to be looking at their data dashboard that has a lot of useful information on healthcare programs and a lot of other working programs in our county and state. In addition, we have breakout groups that we're going to be looking at data and then also trying to source out what kind of data would be helpful for us to know as an organization moving forward regarding enrollments and completions for students. And then we have updates on the HILT Student Experience Package as well, with the Sentinel Network and Workforce Board overview. And then we do have an introduction for a Lunch and Learn that's coming up in December, and we'll be sharing that advertisement as well. So to kind of move forward and begin, we're going to introduce Travis Delaney, who's the Associate Director of Policy Research for the Washington State Board for Community and Technical Colleges. Travis is going to be presenting on their SBCTC data dashboard. Travis, are you going to be sharing your screen?
Yeah, I'll share my screen.
Terrific. I will stop sharing mine. Go right ahead.
Good morning, everyone. So my name is Travis Delaney. I work for the Washington State Board for Community and Technical Colleges, or SBCTC as we call it. And I'm going to be working off of our website today. Am I still there? Okay. And I'm going to be sharing some of our data tools that we have internally, and then I'm going to jump over to the Employment Security Department's website and share some information that we use for website as well. Are you all seeing our website, the SBCTC website? Okay. So I'm gonna navigate to our web page from just the broad SBCTC website, but I'll also include some specific links for you all to be able to access. And I want to start the presentation by explaining that we live in a world where we're sort of wrestling with wanting to know things and protect student privacy. We want to be able to share as much information as possible, but we also have a complex structure of data across 34 colleges across the state, where College A may be coding things differently than College B, and how College C describes things may be the same as College L, except for one letter in a code that they use to describe their nursing students. You know, there's this wrestling between, you know, local control and letting colleges do their own thing, and us at the state board wanting to be able to classify things uniformly across the state. So all that to say that we won't know everything by the end of this presentation, but it is a starting place for you all to be able to look at some of the resources that we have and start forming some questions around the workforce and the students who are coming out of our colleges and coming to work for your organizations. So on the SBCTC website, I'm going to navigate to for college and SBCTC staff. If you click on that tab, you won't get arrested, I promise, even if you don't work for us. No one's going to know. And then I'm going to navigate down here to research. But I'm just going to go ahead and paste this link into the chat to make things a little bit easier. Where is the chat? There's the chat. Okay, so there's the direct link to our research page. Where you're going to be concerned, you have our contact information over here, but where you're likely going to be concerned with is our dashboards and reports public. You can click on the dashboards and reports college access only. Again, nobody's going to come arrest you, but you probably will run into a roadblock there. We have some dashboards there that aren't necessarily secret or have any sort of, you know, private individual student record level data, but the context around them is more for reporting and things that colleges would do internally that you know, if you're not familiar with how the data is gathered and the metrics behind it, probably wouldn't be super useful. So we bifurcated it to allow you to come to the public, click on this public report dashboards and reports here. I'm still seeing the home page, not seeing the research screen. So is it is my screen still showing the main page, or am I showing applied research and analysis?
You're
Still on the main
showing the
page.
main page.
Interesting. Okay, let me stop and reshare. Thanks for letting me know that. What about now?
Nothing. It says you need to double click to display.
It kicked me out. Let me try one more time. Can you see? Oh, okay, cool. Thanks. All right, I'm gonna just, I'm not gonna start over entirely, but I'm gonna click on college and SBCTC staff and then scroll down to research, and that's where I was. So over here on the right-hand side is a link for dashboards and reports public. And so what I was saying is this college access only, you may not be able to access that unless you're on a college campus. And I'll say a community and technical college campus. So if you were at Hogwarts, as we were talking about earlier, that wouldn't work. So when I click on the dashboard or the public dashboards and reports link, we have some topics here. Where I'm going to focus on today is the student progress and completions and the after college outcomes dashboards, because I think what we're really looking for here is how many students are coming out of our colleges with credentials that would qualify them to work in some of the fields where we have openings in the healthcare industry. And what does it look like when our students exit and go into the workforce? What sorts of wages can they expect, and what are the numbers of students who are going into those fields? So I'm going to start with student progress and completions. And click on the credentials awarded dashboard. We have, and you're seeing credentials awarded dashboard, right? You're not seeing like my browser's following, right?
Correct.
Okay. So I'm going to scroll down. We have some descriptive language here, and then scrolling down, we have the dashboards. We embed these dashboards in the page so that we can have a little bit of context around them. If you want to just fill your screen with the dashboard, click on this view dashboard on a mobile device link, and that'll allow you to take it full screen. So I'm going to start with a few of the tabs. Starting with credentials table with demographics. There's some information in here that might be of interest to you, but as we get into these demographic levels, we have to take away some of the other detail. So although you can see, students of color or female students or students with disabilities who are completing these credentials, to protect student privacy, we don't have it down to the program of study level. So to get to the program of study level, I'm going to come over here to the program focus by college table. And we have this broadly grouped across both the credential that was awarded, as well as the program, the broad program focus. So for example, I'm going to start with nursing, and I'm going to unselect all the different program focuses and just zoom in on nursing and hit apply. And so now, if you wanted to know how many BSNs were awarded last year across the CTC system, you'd see by college in this left-hand column. And you could also, you could see the total across the entire system, as well as associate degrees and certificates. Now, what's important to note is that this is a broad roll-up across nursing. So this is going to include your LPNs as well, in addition to, registered nursing. If I wanted to get even more detail, I'm just going to explore some tabs here. I can look at this. Let's see. Yeah. Sorry. I can click on the program type to try to sort out if some of these students were intending to go straight into registered nursing, or if some of them were getting transfer degrees in nursing.
Hi, Travis. Do you
Yeah, go ahead.
mind zooming in for us a bit? Maybe to
Yeah,
150%. That would be helpful. Thank you.
yeah.
And Travis, these are students who completed their degree when? June of 24?
So this would be as of the entire academic year of 2023-24. And so one of the questions might be, are we graduating more students than, this year than we did last year? To just back up a little bit, a student here could have completed in August 2023, or they could have completed in May of 2024. It's just whenever they did it within the academic year. If you wanted to compare years, you could untick the 23-24 and select maybe a pre-pandemic year, so 2018-19. And zoom back out a little bit just so I can see the bottom here where I can scroll down. So back in 2018-19, we had 103 applied baccalaureate credentials awarded in nursing. And we had just under, about 1,800, 1,900 students completing any credential in the nursing category. So that compares to the more recent academic year, was about 2,000 students and 115 BSNs or applied baccalaureates. So an increase certainly, but I think we're seeing short certificates at Clover Park in nursing in the more recent year, and I don't think we were seeing those pre-pandemic. And so that might be a question to pose to one of your college partners about, what is that short certificate? Because I'm not sure. What is that short certificate, and work with your college partners and try to understand the credentials that they're awarding and how those might fit in with the roles that you have open at your, at your organizations. Going back to the chat here, Renee asked, why is transfer AA included in the older set but not in the 23-24 data? We have seen a shift in student coding, and this is, Renee, this is a challenge we've dealt with as we brought our new data system online. In the old system, in the older system, colleges were coding however they wanted to at their individual college. When we went live on what's called PeopleSoft or CTC Link, as we're calling it, there was a little bit more uniformity applied to that. And so some of those colleges who were coding things as a transfer AA may have had to recode it as a different AA when they went on that new data system. Yeah, and sorry if I seem a little distracted. There are window cleaners right behind me. So I don't know if you can see somebody hanging off the side of the window, just banging on the window behind me. So if I'm a little distracted, it's because I'm not sure if I'm being attacked right now or not. Okay, so that's the completions table. These categories are what we would call career clusters. So they're not going to be broken out into like the low level, this is an LPN and this is a RN, or, this is a medical assistant and, this is somebody in medical coding, for example. So that is the completions table. And I'm going to go back over here to the questions. Because I think there was one about navigating. How do we access this data? You mentioned we may get stopped on the website to get in. See, I'm going to go back over to our research page and just point out there are two links here. One is for public, one is for college access only. I'm working off of the public data set here. Okay. Another thing you may be interested in on the credentials awarded dashboard, so looking at the number of people who have completed in our system, is the trend of students completing. And again, this won't have a lot of the low level detail of like the program of the like, you know, nursing or not nursing. But we'll give you an idea of the number of students coming out of our system. And the general trend that we've seen over the years is we're awarding fewer certificates, and the number of students who are completing a associate degree or applied baccalaureate credential are increasing, as well as students completing an apprenticeship. So that's the hey, Janae, go ahead.
Hey, thank you, Travis. Is the number of attendees, students, is that rising or decreasing?
The number of students is, we were hit pretty hard by the pandemic. I think the broad context is our enrollment in general has been decreasing since the Great Recession.
Okay,
We used to have about 500,000 students in our system. Now we're sitting around 270,000.
okay,
And in nursing specifically, that also saw a dip during the pandemic. But some of those coding structure changes that I was talking about have muddied our ability to be able to look specifically at what students are studying. Because we did have a lot of students going into more transfer-based programs, and they'll be masked with the other transfer programs when they code as a transfer student. So we won't see specifically, you know, whether they're a student looking to transfer to get a RN at a four-year institution, or if they're transferring for some other purpose.
got it. Thank you very much.
Any other questions on credentials awarded? Okay.
I have a quick question. I know that I'm wondering if like you have an approximate percentage of folks who might be transferring, you know, to finish a bachelor's versus those who are transferring completely out of the system. Do you have a general sense of that or no?
In terms of looking at our credentials awarded, we do have a filter on here. Again, this isn't going to show us specifically for nursing because we don't have that level of detail built into this dashboard. When we look at transfer students, the percent of credentials awarded for students intending to transfer has remained pretty steady. It's about 35 to 40% of overall students. So that's the level of detail that we have in terms of just broadly across the system for students in nursing, you know, specific nursing programs. Again, we don't have that level of detail here.
Okay,
And
thank
Travis, we see a hand up from Janae.
I think that might be a
Oh,
zombie
that's an
hand.
old side. Okay.
But I do see a question about, is there a listing of the healthcare BA related degrees offered? I'm going to go over to our website and I'm going to Google it. I don't usually look on our website. But I'm going to go to our four-year degree page, because that should have a list of bachelor's degrees that are offered. So BAS programs. So we have a listing by college of which kinds of bachelor's degrees they offer. If you wanted to know, the way I would back into that is to come back over here to our credentials awarded dashboard and look at our program focus by college. And then I'm going to click on nursing and other healthcare. And maybe human services, just because there might be like a behavioral health credential somewhere in there. And I'm going to click apply. And then I can see here that in the most recent year, 72 applied baccalaureates in these fields were awarded at Bellevue. So that might be a good starting place to be able to come over here and look at Bellevue and see what kinds of credentials they offer in healthcare. So they have a applied baccalaureate degree in health promotion and education, healthcare informatics, healthcare management and leadership, radiation and imaging sciences, and so on. They also have the BSN. And then there's a question about post-bac program. I'm not sure, like a BAS. So we have BAS certificates. Is that what you're talking about, Nora?
One of the programs is that Shoreline offers a post-bac program so that people can go on to dental school or medical school. They just don't have they need to increase their GPA. And so they're going back to get, or they don't have the right classes. So they're going back to community college or college to get some of these classes. So I just wondered if they have that listed there as well. Sometimes people don't know about the post-bac program.
Yeah. Yeah, I don't see it listed on the website. So I'll follow up about that if there's a list of those. Because I know that we call them BAS certificates, which is kind of weird. So Bachelor of Applied Science, but certificates. And so I know we have those in our in our data set, but I don't see them listed here unless it's somewhere under. Yeah, I don't see that one. But I'll have to look into that one. Bill asks, will you show us how to display aggregate data for demographics on a degree? So this might be an area where we run into some small n sizes, but I'll certainly try. You'll see a note down here that says counts less than 5 are suppressed. So as we get into some demographics with a small number of students, you may not see any students in that program. But we have a filter here for race and ethnicity and gender. And so if you're wondering about students who are 2+ races, Black, African American, and Hispanic, for example, if I click apply, you'll see some data for students in those groups. And so if I click, for example, Pacific Islander, you're likely to see, a lot of the data disappear. Now there could be at Bellevue 4 students who completed a degree who were Pacific Islander, but they just wouldn't show up here. And so I just want to caution that especially when we get into some smaller demographic levels, some of that data will be hidden. And then Renee asks, will SBCTC be changing the race ethnicity collection to match the new federal standard? If so, when might we see that change or greater disaggregated data? We don't have any plans to change how the data is displayed here, mainly because that's how it's collected and aggregated by our data services team. So we don't have any plans to make any changes in the near future. Any other questions on completions before I go on to the after college outcomes dashboard? Okay. So I'm going to navigate back to the research page. Hopefully you're still seeing my screen moving rather than just the single page. And I'm going to scroll down again to dashboards and reports, public, which you all can access if you just go to the web page. And I'm going to select after college outcomes. And I'm going to select our professional technical programs and apprenticeships. We have a link in here for our four-year baccalaureate institutions, as well as a link to the an external agency. It's the Education Research and Data Council. No, Center. Sorry, they're not a council, they're a center. And they have some additional dashboards, so you may want to check those out. I'm going to focus on the professional technical programs and apprenticeships tab. And again, scrolling down and pulling up the dashboard. This dashboard is intended to provide a very broad level of information on where our students go after they exit our system. So this is going to include both people who complete and students who do not complete but have left the system. One thing you'll notice is the data looks a little bit old because, the latest year we have is 2021, 2022. The reason for that is that we have to wait a year to see if the student came back before we count them as an exiter. So there's going to be a delay on the students who are included in this data set. And this data set will is based on exiting cohorts. So if you're looking at the 2021-2022 year, we're looking at students who exited in that year, and then we didn't see them in 2022-23. So this first tab is going to look at the placement rates of students who are placed in jobs. We define that as 3 quarters after they exit. And so if a student exits in January, and then we see them in a job in the September timeframe, based on the unemployment insurance data that we get from from ESD, we'll be able to count them as somebody who is employed in the state. What we're looking at right now is the placement rates of students who exited, for example, in the 2021-2022 academic year. We're seeing that 76% of students who completed, so that's the blue bars, were placed in a job in the state. Were they placed in a job in their field of study? We don't really have that information. We just know that they were picked up in a job. And we can see their industry, but that doesn't necessarily mean we know what they're doing for work. So the biggest example of that might be a student who exits and gets a bachelor's degree in software engineering from, Bellevue College. They may go work for Costco and build out, some highly technical, really cool, retail tools. Or they could go work for Amazon and be a software engineer at Amazon. They would show up as working in a retail industry. So they could also be working at Buckle at the mall. So there's, we don't see their occupation level detail. The orange bars here are the percent of students who left our system without completing, who were found in employment. So the takeaway from this chart, immediately is that if you complete a credential when you exit our system, you're more likely to be employed. Just like on the other tab, we can filter down to some of the areas that we might be concerned about for this group, which would be human services, nursing, and I think we have health services. It was other health in the other tab. Health services, and let's look at health tech as well. I think health tech is a pretty narrow area of study. So what we see is that 84% of students who exited our system in the most recent year who completed found employment in Washington State. 71% who didn't complete were still able to find employment in Washington State. So what about what do students earn when they exit our system? So I'm going to come over here to this tab called Professional Technical Earnings. And just like I did in the other tab, I'm going to filter to some of our health related programs, health services, health tech, and let's click on nursing. And I can see based on what students were studying, not necessarily whether they were placed in a job or not, but or excuse me, not necessarily whether they completed or not, but for students who exited in these areas of study, what were their wages? For nursing, the median earnings was about $84,000 a year. If you hover over these bars, you'll see that we had about 1,400 students exiting in this career cluster in the most recent year for which we have data, with a median earnings of $84,000. Looking at health tech, about 1,000 students exited and were found in employment with a median earnings of 52,000, 51,000. And then health services broadly, about $42,000 in median earnings for about 1,000 students. Like some of the other tabs, this has some demographics that you can filter down to, but do keep in mind, you'll see some masking if we get into some low counts. And then this dashboard also has a more detailed field of study. So I can come down here and look at nursing assistants and nursing aides specifically. And I'll see that they fall under health services. And they had a median earnings after they exited our system of about $33,000. And you compare that to registered nursing. I'm going to go over here to select all, deselect all, and select registered nursing. And obviously the wages and earnings are significantly more at about $86,000. I'm going to remove this filter. And I think, when I was talking to James, there was some other questions about like maybe behavioral health. That one's kind of, I'm going to try to hunt that one down. But it might not be under what you think it's titled in this dashboard. So if I click on, if I select behavioral health and then click on behavioral science, let's see if that, let me reset this, sorry. I'm not getting any records for behavioral science in the most recent year. If I come back here and I select more years, I'll get some data. There were about 37 students in the entire system who got this credential. So that doesn't tell us a whole lot. And so I might come in here and look for mental health counseling, environmental psychiatry, mental health counseling, mental and social services, and just add in some other fields that might give us some more records. And that gives us about 514 records. And so still with about a median annual earnings of $36,000. One other thing to note is that these are inflation adjusted. So, if you're looking at some older years, we've rolled that up to the most recent. I think this would be the January of 2022 is where we're adjusting that to in terms of inflation. Renee notes that the zip codes are a bit of a mess for behavioral health. And yeah, some of this requires a little bit of digging. So that's the after college outcomes dashboard, to be able to look at some of these fields and look at, what, both how many people are completing in our system, uh, with these different credentials, and what are they doing after college? What percent of them are employed? And then what are they earning? And that can be informative for you all as folks looking, for people to fill vacancies you might have. The other area I'm gonna just go to quickly, and I'm not gonna spend a lot of time here because it's not my dashboard, it's not my data, but it's something I use frequently, and that's the Employment Security Department Labor Market Info website. And I'm gonna paste that in the chat. And hopefully you all are familiar with this field or this data as well. But um, over here on the left-hand side, there's a supply demand report, which can be helpful in understanding vacancies, and the difference between those who are in these roles already and the number of people or the number of job openings that are available for them. So there's a nice website. It's by region, uh, on the ESD site, and you can go in and click and find, okay, so by region, how many job postings are there, let's say in Seattle, King County, Tacoma, Pearson, Snohomish, and you can see by occupation, by broad occupation, how many job openings are available. And you can even come over here to a data and gap analysis tab to be able to see the gap between the number of folks working in these industries and the number of job postings that are available. And again, you can sort that down by region. So you could come in and look for behavioral health, substance abuse, behavioral health, and mental disorders counseling, and be able to see that there's an estimated gap as of the latest date of April, of about 274 people, or job openings in Seattle, King County in this occupation. And then the last thing I'm going to highlight, if you haven't done so already, is to, let me see if the link is here, is to contact your local economist. So ESD, or regional economist. So ESD has a army, I'll say more of a platoon, I guess, of regional economists who are experts in not only the data, but also, understand your areas. And they're a terrific resource. So I would highly encourage you, if you want to dive into this occupations data and see what kinds of employment gaps are available, and what the regional workforce looks like, I definitely recommend reaching out to your economists. And I'm going to link that now. So that's all I had to share. Any questions? No, it's kind of like a fire hose of information.
Yeah, no, thank you, Travis. Really appreciate that. How about a virtual round of applause for Travis and SBCTC? Thank you very much. As we can see, data is definitely dense with information, and it takes a little bit of knowledge on how to sort through the data, find out what you're wanting, and then obviously for it to list out the results that you are looking for. And thank you, SBCTC, for your partnership and your support. And Travis, fantastic job sharing that overview of the dashboard.
Yeah, and just real
Yeah.
quick, while we're talking about partnerships, I did want to give a shout out to Renee, with the Workforce Board, and she's a terrific partner that we work with. So we're very, very grateful to have her in the room, especially she's in the room now, just keeping me honest, quite frankly. So
I'm trying not to drag you down the rabbit holes of SIPs and SOCs, because these people do not need that.
Yeah, cool. Thanks, Renee.
That is funny. No, we really appreciate everyone's support in this, and this is definitely something to dive deeper in. So I'm going to reshare my screen here and just showing we're gonna get ready to go into breakouts. 1 second here.
James,
so,
can I interrupt just really quick?
Yeah, absolutely.
I did want to recognize somebody. I think Rachel is still in our midst, if she hasn't dashed out already. But if you don't know, we have a new elected official here at HILT. Rachel was successful in her campaign to become a Thurston County Commissioner. So I want to recognize that, and let's give Rachel a huge round of applause. It takes a lot of courage to run for office. It takes a lot of work to run for office. And while we're going to be missing her in her role, but I wanted to acknowledge that because I think it's just fantastic that we're going to have, in our elected officials, someone that really can advocate for health equity, can advocate for the work that we're doing, among other things, for their community. So, Rachel, I will give you the option if you want to come off mute and provide your recruiting pitch for folks too, because we're going to be sad that you're leaving us, but we are so thrilled that you were able to be successful in your campaign.
Thanks so much, you guys. And okay, election data isn't official yet, so I just want to let you all know, but I am I'm ahead in the points. So yes, I will be leaving. I do want to put a shout out to everyone on this call that we will, right now there is a King County PPM4. It's just kind of the way that they put things out, but it's a project in Program and Project Manager 4, Strategic Workforce Manager position. That is my position. And it just was released on Friday, this last Friday, as an open position. So if there's anybody who wants to come in and continue to lead this amazing work that we've been doing here at King County around workforce, we need you. Or feel free to share that out to folks that you know might be interested in taking on a strategic role for workforce. So I just wanted to give that shout out, and I appreciate all the congratulations. Yes, being elected means I will be leaving King County. It's a full-time role in Thurston County, but for those of you who live in Thurston County, yay! So we'll continue all of the behavioral health work and workforce work that I have learned over the years in Thurston County. So thanks so much for the support, you guys.
Terrific. Congratulations. So proud of you, man, all that good work. And so we eagerly look for those final results, but it looks like definitely something to be congratulated with. So we are moving on to our breakout sessions. And so now that you've heard a lot of the data that we had from SBCTC, we want to kind of focus a little bit on what other data points do we want to see in the future. These are something that we want to gather lots of feedback from those breakout groups. And really we want you to share your reflections about the dashboard data presented and give your honest feedback and what you liked and what you gleaned and what are some other areas that could be added in. And then also we want to kind of gather more information on what data you want to see in the future. Here are a list of data points that we were kind of considering, but if you have some other areas that you want to include, please feel free to include that in the discussion. We're looking at top health care academic programs. Which ones do you want to see? We typically think of the RNs, LPNs, mental health, but what other areas would make sense? Would be pharmacy, radiology, or any other that positions that have? And then how large of an area would impact your work? Would that be just, in the region, in a particular county, or would you like to see state level data or even national data? And then how many years of data would make sense for you to have? Coming out post-COVID, would you want pre-COVID, COVID, and post-COVID, or does it just make sense to have, the last 3 years? And then types of demographic information to include what level and how would it be used? I think many times we ask for, we really want that data to be impactful. So what data is going to be useful for your work? And then once again, any other data points to include. We have pre-assigned the breakout groups. And once again, we want to glean a little bit more and understand what data can we provide in the future. We're going to be in breakout groups for about 20 minutes. So 25 minutes. So it's a little bit of a brief time. And then we're going to come back, do a report out, and continue on with the meeting. So all rooms have been pre-assigned. I'm opening the rooms right now. Aha, Andrew.
Did you intend for me to stick around, James, or
It's up to you, Travis. You're more than welcome.
okay. I'll probably hop off, but let me know if there's any follow-up.
Okay, terrific. Thank you. Thank you so much for your support. Really appreciate it.
Yep, thanks. Have a good day.
Yep, you too. Come on in. I've got 3 minutes, man.
Use the restroom.
Of course. Yeah, of course. Sure, how you doing?
Difficult today.
Yeah, you okay? What's up? Just the politics or?
So many things going on. 700 people have killed themselves.
What?
Yes, suicides have rate increased like crazy.
Really?
Yes,
Wow.
the number just keeps getting higher.
Wow.
And there have been so many posts on women's social media of saying how go back into the kitchen, we're gonna rape you. Remember to close your legs now. All these fucking
Where you see that stuff at?
Oh, it's on TikTok too. There's all these comments on everybody's post.
Wow.
It's insane. I never seen such a divide like that.
Yeah, dude, this is.
In the state of Texas, there was these guys that put on some huge poster saying how our property are now women, slaves, or guns, and something like that. In the state of Texas, at a college, those guys got beat the shit out of them. So that was cool. It's just like I've never seen such more like political and like such struggle. Holy cow!
Yeah.
It's just really scary to see. And it makes me really worried for Preston. So.
Well, you know, we're down. You know, sorry.
There are people living with the polls already, so people are fighting Latino men just on the street randomly.
Wow.
Because of what's happening.
Yeah, we gotta be real careful. You have that pepper spray in your car, right?
I think I do.
Okay, just making sure. We just want to probably make sure we've got some stuff. You know,
It's just like, it's just very scary.
yeah. Sorry, we're in breakout groups, and they're going to come back into the main room in a minute. Okay, thank you, Mijo. Oh. Hey, Brock, welcome back. Hey, Karina. All right, welcome back, everyone. People are starting to trickle back in from the breakout groups. Hopefully that was a good discussion and we gleaned a lot of good information regarding data, data needs, data wants. We'll give everyone a few minutes just to come right back. Welcome back, everyone. People are starting to trickle back in from the breakout groups. We really appreciate everyone's collaboration and input regarding data, data needs, and what we would like to see in the future, especially after seeing how dense data can be. Terrific. I think we've got majority of people back, so welcome back. We're going to go ahead and move to breakout groups report out, and the first group that we have is Abby's group, followed by Ryan. So Abby, either if you had a representative that was going to do the report out, please welcome to share.
Okay, I will try to summarize this because our group was amazing. And I took like 3 pages of notes. So I'll try to summarize this. So just bear with me. But so general reflections. Obviously, it was definitely aligned, I would say, amongst the group in terms of what was presented. So definitely the consensus was, valuable. Very specific in terms of just what was shared, just how deep it really got with some of the subsectors, subsets. Radiology was called out. Definitely just honing in, and I just think it's important to obviously just not miss the just kind of those other non-traditional, non-visible healthcare positions that are sometimes overlooked. So that was just interesting, I think. And then also something to consider from the reflections is, when we think about, the wages with some of those roles, right? And I think something that's often missed when you compare the wages to some of the demographics of who's going into those roles. I think there's a larger conversation that can be had around who is going into those roles and why, and maybe, thinking about, are we funneling people into based on what we think they need versus what they actually need, right? So, if it was shared. So for example, it will say, if we're seeing, for example, that, nursing assistants is primarily, individuals of color, we'll just say, versus nursing is, white women, that kind of thing. I think there's a larger conversation to be had around the equity around that, and ways to ensure that we're creating pathways around, ensuring that, individuals are having the opportunity to get into those higher paid roles. Because from a holistic standpoint and overall standpoint, we need individuals, we need people of color in those higher paid roles, to, essentially, we need people in the higher paid roles, because sorry, I'm tripping up on my words right now. I'm like trying to read my notes as well.
It's
So,
for health. It's for health
yes, for
implications.
health. Yes.
Yeah.
Thanks, Ellie. Sorry about that. Yeah. It's overall health of what it is. And then, sorry, going on to the next page. And then we basically just were talking about a lot of stuff that we were hoping to see, or we want to see, I will say, is expanding the continuing education of the data. So breaking down, it'd be really interesting to see kind of the why. So, what are those alternative pathways? So if something doesn't work out, right? So, if somebody goes into, let's say, someone's in a post-secondary pathway, they're in a and they decide to change their major, or they want to go into nursing and it's not for them, what are those kind of wraparound supports that can be done, to help support them either change that pathway, or, what kind of surveying can be done to kind of say, hey, although this didn't work out, kind of the whys around that. Karina actually brought up a really good point that is actually happening on the East Coast, which essentially is a surveying thing that is being done. It's called first destination reporting, which I thought was interesting. It's essentially where after nine months, so essentially when individuals graduate, so let's say they graduate with their degree, the school will send out a survey to them 9 months after they graduate, essentially just, it's optional, but essentially just asking their income, assessing, where are they working, all that kind of thing. And so, and again, it's really just to kind of gauge, just, essentially, what did that pathway work out? Again, what kind of support is kind of needed. And then again, like what happens if somebody changes or leaves? And then again, it just helps tell the story. So I think the overall census of our group was really about post-secondary. It'd be really great to see if there was a post-secondary dashboard on like a dashboard level, or a common data dictionary. So anything pathway tracking. So whether that's, essentially being able to track individuals that go through a program from start to finish. And if they don't finish a program, being able to kind of see the whys. Something that also came up that was interesting is, how do you measure, in terms of elements to kind of measure and data to measure was, how do you measure and define satisfaction? So when somebody says they're not satisfied with something, or when we think about retention surveys and things like that, or why people leave, how does one define satisfaction? I thought that was pretty interesting. Obviously employer check-ins, retention surveys. So very heavy on post-secondary in our group, and just building out that pathway piece. And sorry group, I feel like I butchered that. But our group was amazing. It was very engaging. And yes, and feel free
Terrific. Thank
to
you.
jump. Sorry.
Yeah, no, thank you, Abby. Thank you, Abby and her team. Really appreciate all the good feedback. Moving on to Ryan, and then followed by Angie.
Yeah, so a couple of big things that came up. So big, like I think there's an acknowledgement that a lot of the data that we want is siloed in different areas, right? So SBCTC has like the academic data, ESD has the employment data, although that has some limitations to it. The job demand data lives at each of our industry partners, and so these data points are all kind of siloed around, and so kind of pie in the sky look is like, hey, if we could integrate these without, of course, violating individuals, personal privacy, which is critically important. So I think that was kind of one of the big themes that came out. Some specific things. We did have some conversation. Bill shared around there's a new pathway for behavioral health support specialist that's being developed, and so looking at what does that pipeline look like? How are individuals going into that? He mentioned that there's a competency framework, and people are advancing through that pathway. With respect to drilling down to data, particularly race equity data, there was a question about whether maybe we could get a report about white versus non-white participants, just to eliminate some of that small N problem that Travis talked about. Recognizing that there might be one African American nursing student at Yakima Community College. And obviously we can't identify that person in the data. We don't want to be able to violate that data integrity and data equity component. But is there a way that we could look at from a larger lens, what that pipeline looks like? One of the things that came up too that was interesting is that some of our employers, they will have multiple jobs for a single job posting. So for example, if they have a posting for an ICU RN, they might be hiring 4 people based on that job posting, but there's no way to know that. So some of that data scraping that happens may be incomplete, and that might result in, for example, data showing, oh, there's fewer RN positions available because we scrape based on the job posting data, when that's not really the case. And in order to get to that data, you actually have to go in the back end of the system to be able to see that, which is not what's going to be able to happen with some of that publicly scraped data. So those were a couple things that I would invite anybody from my group, if I missed anything that you thought was really important to share, to come off mute and add.
Terrific. Well, thank you, Ryan and his group. Really fantastic feedback with that. We'll follow on with Angie and then Wendy.
Hi, everyone. So there are some kind of common themes that we're seeing as we're talking through. We did have some. We had a great group together with a lot of community resources, and I think some of the things that came up is just the continued, I think, diligence around looking at the data and ensuring that we understand whatever those caveats might be. A lot of the ones that Travis mentioned when he talked about it or presented his data set. Also, being able to look at those additional layers of demographics, obviously taking into consideration, like what you said, Ryan, we don't want to betray, any confidentiality or, any specific or student data individually, but at the same time, is there a way that we could, tie things into, closer and smaller groups so that we could help identify, where we might need to target specific programs, or if we have a specific program, we have a specific group, it's been built for, how do we know if it could be potentially impacting that group? The other piece that came up was around data, data around the completed and non-completed degrees, and how it would be very compelling to be able to find out, and I think someone mentioned this earlier, what are some of the reasons behind non-completions, and is there a way, to get that data, or at least, whatever the top, reasons might be, and then somehow figure out how we can tie that back. It turned into a conversation around how do we loop back the right programs to these students at that decision point. How can we make sure that they, are able to address some of those barriers that they are having or experiencing that's pulling them potentially out of these programs. And then that led to additional conversation around, any gaps or the gap that can happen between someone who completes a program, so the folks who actually complete it, between that completion and their first job. What are those, resources or additional things that we can provide there and tie folks in? So not specifically dashboard related or information that we can get in, but it was really great to see some of the ideas and thoughts that were generated because of either the data that we have or the data that we would like to have. And so that's where our conversation kind of ended up going. Renee also shared in chat some more detailed feedback specifically for Clover Park. I'm unfortunately, Renee, not able to see that visual that came through, so would love it if you could resend that as an example of how and some additional detailed reporting that we might be able to get or look at. But overall, it's great to be able to see the data, understanding, but it's really around how do we take that data and do something with it. And then how can we potentially rely on and look at some of the other sources of the data. There were regional economists that were mentioned. Are they just numbers people, or are those resources that we might be able to pull on as well? Thinking about how they can, how we're getting, or how we might be able to, again, support getting people filtered into the right roles where we have those gaps. So team, that was a lot, and I'm sure I probably butchered it as well. So anything anybody else wants to pipe in from our group would be great.
All right. Well, thank you, Angie and her team. Really appreciate all the information and feedback. Sounds like a really rich discussion. Moving on to Wendy, then Betsy.
Yeah, thanks, James. Good morning, everyone. First of all, I just want to apologize for my absence in kicking off and welcoming you all to this meeting. We had a great conversation. We were well represented from Pierce, King, and Snohomish County, so it was really nice to have that that kind of diverse geographic conversation. I think a lot of similar themes. I love hearing what the conversations have been. We talked overall, really glad to see this data resource. Some were new to it, so that was really helpful to have that shown and then walk through. Just a recognition that we need to learn how to get fluid with and comfortable with navigating these resources so that we can effectively use filters, because there is a lot of data at our fingertips. So just getting really fluent in using those systems. We had a curiosity around how often the college data is refreshed. For instance, how often are the colleges reporting this data? Is that annually based off of the previous academic year? Is that more frequently throughout the year? I think a similar recognition that there's some limitations, like I think was already discussed around the consolidating so many healthcare programs into one data category. Other healthcare programs, healthcare support, that really is a limitation in getting very granular and understanding a radiology, a rad tech program, or what's the pathway specifics in surge tech, or so that is really helpful to, if there's possibility, just, I think the SIP codes and the SOC codes are part of that infrastructure, but it's limiting to not be able to see those program specific areas. Nursing we can see, but others are more challenging. Let's see. Demographics are really helpful. There was a recognition that we appreciate having the ability to drill into different demographics, and echoing that we'd like to see alignment with the federal identity categories. So just echoing that request for our state systems to align there. We had a conversation about capacity and whether the dashboard, the data in the dashboards can give insight into the college capacity. For instance, we can see enrollments and we can see completions, but the number of enrollments doesn't necessarily show us how many could have enrolled. For instance, to understand if there's a constraint, an access constraint in that program area. So not sure if there's a way to kind of reflect that in our data systems, but as we know, it's hard to get into nursing programs, but there are other programs that are declining in enrollment and have capacity. So I think it's important for us as we think about the health of the pipeline, having insight into levels of interest and levels of enrollment as compared to what the colleges can enroll and serve. And then we just kind of veered up. I think data-wise, apprenticeship also came up for us. We were interested in more access to apprenticeship data. There's more and more healthcare apprenticeship programs coming online, and that there was a recognition that we have not only community and technical colleges involved in delivering apprenticeship instruction, but there are other community-based providers providing apprenticeship instruction. And so is there a place where we can have kind of a consolidated picture around what's happening in our system around apprenticeship? So that would be helpful to this notion of data being siloed in different places. And then we just started having a little bit of conversation, kind of tactical around where are the bottlenecks in the system? And we talked about instructor availability. We also talked about clinical placement availability. And we just had a great dialogue. And I think I'll leave it from there and also just take a quick pause for others that want to chime in.
Great. Thank you, Wendy and her group. Really appreciate all the good comments. Moving on to Betsy.
Yeah, so I put our notes here in the chat so you have them for posterity. But we similarly all loved the data, felt like it was really useful to have one spot where all of this data was accessible. Some of the other data points that our group brought up of interest would be more details on the outcomes of the students. Where did they go geographically? Did they stay put? Did they move around in the state? Did they leave the state? What kinds of work did they take on? Were they working in hospitals? Were they becoming a traveler? Having some of that information would be useful. The licensing process timeline. So how long after they graduated did it take them to actually achieve their credential and begin working? Because we know that there's some delays impacting the system. Then thinking about how colleges are working with employers, so the career-connected learning piece, there was interest, is there a way to somehow identify which school programs are working with employers and which employers, and then data beyond traditional school programs. So we talked a bit about some of the other skills that are important, like communication and leadership, and maybe thinking about some of the other places where people are obtaining education, like Coursera or certificate programs out there. There's so many spots, and there's these digital wallets that are becoming more popular. I went to a session, the Workforce Development Conference last year, where Career Bridge was talking about how they were doing this work with Providence. So I don't know if anyone from Providence knows about it, but maybe a future topic to look at those kind of digital wallets of containing all the various learning opportunities that people can take advantage of, and having those certificates, credentials in one place. We talked a lot about the desire from the group to understand why people weren't completing and be able to intervene. Like, was there a way to have students opt in for a consult with a community provider that they could share resources, internship programs? How can we better support those who are not completing the programs? And, really just making the workforce stronger. I think I got everything. If anybody from the group remembers anything I missed, feel free to pop on, but there you go.
All right. Well, thank you, Betsy, and your group. Sounds like a lot of good discussion points. Really appreciate everyone's feedback, and I will ask the breakout leads if you want to go ahead and write that up, and if you want to send that over to me. I do have the notes from Betsy as well, so there's additional information for us to include. We'll be gathering all this data, getting this all collected and synthesized, and then we'll be moving that forward for additional data presentations in the nearby future. We're going to move on a little bit here, but thank you everyone for all the good engagement. We are going to be moving on to the student experience package. We've got Christina Castorina and Karina Geisler-Wagner.
Awesome. Thanks, James. Hi, everyone. Karina, it's nice to see you again. So really quick update coming out of WOBS today and the student experience package. And there we go. Okay. So just a reminder, when we talk about the student experience package, we are talking about these three packages kind of rolled up underneath of that. One is the video library, speakers bureau, and our annual Sound Careers in Healthcare event. So if you were here in September when I did sort of an opening presentation about the state of the student experience package and what we were hoping to focus on for the 2024-2025 academic year. For the video library and the Speakers Bureau specifically, we were really looking to get feedback from our K-12 partners to understand how they utilize the resource, when they utilize the resource. And then, of course, collect some feedback around sound careers and healthcare as well, which we're always doing. But as we've shared many times, it is the most popular, the most demanded of the three in the student experience package. So on the next slide, I just have a couple of quick updates, everything up there at once. So we have done that. We've collected that feedback from our K-12 partners on the student experience package. We delivered it to the HILT conveners and it's been shared with the HILT captains, and we'll have more information on that and kind of next steps coming out of that feedback in the near future. With respect to the Speakers Bureau, I think I've mentioned the Rainier Beach HOSA Club's request in 2 other HILT meetings, but not the big one. So I wanted to make sure I put in a PSA. We need speakers. There are 30 individuals total in the Speakers Bureau right now, and only 5 of them updated their profiles for this academic year, and only 1 of those 5 currently is available for the Rainier Beach HOSA Club. They're looking to fill a year-long schedule of speaking engagements for these students. So I think, thank you, James. I think an email template has already been sent around. You may have received that. If you'd like to receive that, to send it to anybody in your network, please reach out and I'm happy to share that. But I am specifically looking for individuals who are medical assistants, anyone in the behavioral or mental health fields, anyone in the occupational therapy field, technicians would also be good. We've talked a lot about radiology, any type of diagnostic imaging. So lots of openings. Please, please, please share that we would like some speakers for the Rainier Beach HOSA Club. And finally, planning for Sound Careers and Healthcare 2025 is well underway. So our planning committee is officially convened. Our first meeting will happen later this month. The event venue is still technically TBD. We're hoping to get a decision very soon. And just to recap for everybody here, that decision is between University of Washington, where we've been for several years, and a new venue at Seattle Center, which will actually double the size, the capacity that we have. So there is that demand there, and it just is dependent on the type of funding that we're able to secure for this year. And lastly, I wanted to just do an FYI here. Volunteer recruitment for Sound Careers and Healthcare 2025 is going to kick off in January. So I just wanted to put that on everyone's radar because we will need your help to recruit all of those volunteers. So please stay tuned. I know we're heading into holiday season, but as soon as we get back in January, it will be hitting the ground running with that recruitment effort. And that is all I had for updates today. So any questions?
We have a question from Marita.
Hi, Karina. I
Marita?
just wanted to ask, I know we're on that first meeting, are we going to determine the date? And I asked that because I'm running into situations where I'm getting asked because our internal partners are planning other events, and I worry we're going to lose out if we don't get a date pretty quickly.
Yeah, so the date is dependent on the venue decision. So as soon as we have a decision on the venue, we will have a date, and I'm hoping that we can communicate it perhaps even in advance of that first meeting, but certainly no later than that first meeting.
Perfect. Thank you.
Yeah, of course. Other questions on the student experience package? Perfect. There's me. Feel free to friend me, connect with me on LinkedIn. All social media platforms are the same. Let's be friends. But if you have any questions, please let me know. Happy to answer. Thanks, everyone.
Terrific. Thank you, Karina. Thank you, Wobbs, for all the good partnership and collaboration. We're moving on now to the Washington Sentinel Network with Benjamin Stubbs. Ben?
Sorry, I thought I was unmuted there. Thanks for having me again. So I'm here to give you a brief update on the Sentinel network. Renee and I were here in September and gave a lot of information about the Sentinel network, but in case you aren't familiar, can go ahead to the next slide. The Sentinel network is another data source, a tool to gather information from employers around the state in the healthcare, in all healthcare sectors, to understand their needs around workforce. And so there's a link at the bottom, and if you're not, haven't explored the data that are available on the website, I'd encourage you to do that. So my focus today isn't to talk about what is this health workforce Sentinel network, but to let you know about a few upcoming changes and get some information from you. So next slide, please. So in the past, the Sentinel network has collected information twice a year from employers, and the goal is to understand changes in their workforce needs. We're finding that maybe twice a year is a little too much of a burden for folks, and also that maybe isn't giving us as fresh information as we had hoped. So we've decided to scale back to one data collection per year, which will happen in April or spring of each year, most likely in April. So to let you all know that we won't be doing our fall data collection, which would be happening right now if we were doing it. So if you have participated in the Sentinel network before or been users of the information, just to let you know that that fall data collection will not be happening. We're also working to simplify the questionnaire and really focus on the topics of interest for folks. Okay, next slide, please. So I had thought, James, I think I'll skip the Zoom poll for these questions in the interest of time. I had planned to present these questions to you and have you answer them, but maybe in the interest of time, what I'd like to do is show you a few questions that we're thinking of asking this next spring, and ask for your feedback as to whether you think these are good topics to ask about, or if you have other topics that you think would be important for us to understand from employers. So the first question we're thinking of asking is something around, we're hearing anecdotally that there have been kind of more layoffs or more maybe hiring freezes happening in the healthcare sector. And so asking some sort of question around that of employers. And so the question we're thinking of is, in the past 12 months, has your facility experienced any of the following staffing changes, either facility-wide or within specific departments? And then select all that apply. So the options are staff layoffs in specific departments, staff layoffs facility-wide, hiring freezes in specific departments, or hiring freezes facility-wide, or other staffing changes, and then there'd be the ability for them to write in an answer so we could get information about other things that are going on, or no significant staffing changes. So I'll let you think about that and then give you another question that we're thinking of asking. This one about the use of contract or travel workers. So this would be, how would you describe your facility's use of contract or travel workers now compared to with your use a year ago? And so then a variety of options where they can indicate how they're using travel workers now compared to a year ago. So just wanted to get some feedback from you all. If you could go to the next slide, please. Are those topics that you think are important to understand from healthcare employers, with keeping in mind that we'll be asking these questions probably next April? And if not, are there, well, if so, are we asking it in the right way? Are there things that are there ways we could ask it differently? And if these aren't important topics, do you have any thoughts of topics that you would want to know about, you know, from employers? So I'll stop there and open it up to a little bit of feedback from you all.
Yeah, Betsy.
Sure. Well, Benjamin, thank you so much for sharing this information. And I think both of those are good questions. They make sense to me. I think one question I have is when I've looked at completing this survey, I've needed to kind of draw in from different people that information. And so I wonder if there's a way to get a PDF or something of the survey where we could share it with the folks we would need to get that information from so that we could better complete it.
Great. Yeah, thank you. That's great feedback. We're working on trying to simplify the process, so that's something that I'll take to the group and see if we can facilitate that for you.
Great. And I'm not sure if I'm 100% remembering this correctly, but I know for Kaiser Permanente, because we are unique, we are both an insurance provider and a care provider. There wasn't always a category that fit us correctly. Like we're not a large hospital, but we are a large organization. We're not a community health clinic. Uh, so, maybe we're just the unicorn, but if there was any way to add a category that applied to our kind of organization, that would be helpful.
That's a very timely comment. We're working on that exact issue right now. So if you wouldn't mind, maybe I could follow up with you afterwards and try to get some more information from you around that of how we could help you with that.
Yeah, thank you.
Yeah, that would be great. Well, if there isn't any other feedback now, I'll leave my contact information. You can see it here and I'll put it in the chat. If you're ruminating on these things and think of something later, please do contact me and let me know if there are specific topics you'd like us to ask employers about in the spring. So thanks for the opportunity to give that update and hope to hear from you all soon.
Thank you, Ben, and thank you for all the good work. And yeah, if you have some additional information that you'd like to see represented or questions, please do reach out to Ben. We are moving now on to the Washington Workforce Board with Renee Fullerton.
I think I have 5 whole minutes to do this presentation. So my slides did not transfer over well. Okay, forgive the weird color choices on this.
Oh.
So hello, I'm Renee Fullerton with the Workforce Board. It's lovely to be all with you today. I always appreciate a chance to come into the HILT space. And so I was asked to give a bit of a legislative preview, looking ahead to 2025 legislative session. What are things that we're hearing about in the policy rooms that may move forward into our legislative process when it begins in January? This was a bit of an explainer. I'm going to cut this down a lot, but overall right now we're sort of in the final stages of the process of folks are drafting recommendations. Many different reports are in approval processes right now. If it's coming from a state agency, stakeholders who are outside state agencies are finalizing kind of what their agendas are going to look like for this upcoming session. But things aren't quite fully formed yet, but it's going to rapidly gel as we move through November and December, all in preparation for the start of our next biennial legislative session on January 13th. So I'm going to acknowledge I was doing these slides last week before the election, and this feels a little bit flip at this point. And so I will say just the overall message is that things are going to involve a lot of unknowns this upcoming legislative session. Here within Washington, we have many legislators in both the House and the Senate due to retirements and people moving from House to Senate, which means there's a lot of new educational opportunities because people may not be familiar with the topics that are most important to you all as healthcare employers. We have a new gubernatorial administration, so we will be seeing potentially a whole new set of policy priorities coming out of the new administration. We'll typically see the secretaries of the agencies will turn over the next initial part of 2025. And you'll see sort of rolling impacts over time as the new administration comes in and sets its priorities. That may or may not impact the budget. From what I understand, sometime the governor right now is crafting a budget. Governor Inslee's office undertakes that work, and that will be available in mid-December. Sometimes the new administration comes in and makes a few changes, but basically moves it forward as is. Sometimes they come in and they rewrite the whole thing based on their policy priorities. So we don't necessarily know if what Governor Inslee's team identifies in their budget will be what holds and is sent forward to the legislature in January. We now, of course, know that the initiatives are not impacting the budget, which is helpful. The messaging we are hearing in Olympia around the budget situation next year is that it's very challenging. I've heard a range of numbers quoted for the amount of deficit that we are looking at this year, but it is a situation we have not been in for probably 10 years, that we've been looking at revenues being less than what projected expenses are, and hard choices will need to be made during this upcoming session, which is different than previous budget years, you know, when there were revenue increases and people were able to allocate money in new ways. So I picked out a few things, but you have these slides, so I'm not going to go through this all in depth because there's just too much to get through. I wanted to draw attention to a few key policy spaces where reports are coming out. The first is the Children and Youth Behavioral Health Work Group. I know this team has a particular interest in behavioral health, and so they are finalizing their full report and recommendations went in November 1st. The secondary supplement will go in December 1st. And so I pulled out a couple of their key workforce recommendations, which include the creation of a behavioral health teaching clinic rate enhancement under the Medicaid program, which would flow additional funds to the behavioral health agencies to help support their training functions. There's a strong interest in continuing the work Ballmer Group started around conditional scholarships for master's level behavioral health providers. There's work around supporting Medicaid rates to equal Medicare rates to make sure pediatric community health workers are able to be paid at a livable wage. And there's a large discussion around the health plan assessment to fund an overall Medicaid increase. And of course, that's not necessarily workforce per se, but rates and payment is so closely tied to people's ability to hire and increase staffing that it's hard to go without talking about that particular item. Department of Health is bringing forward recommendations around streamlining behavioral health credentialing. This is the second year of recommendations following House Bill 1724 in 2023. The State Board of Nursing is looking to move authority for nursing assistant professions over from Department of Health to the State Board of Nursing. And there are a variety of other reports that are in that approval process right now, so I can't bring them forward to you explicitly, but keep an eye out for State Board of Community Technical Colleges. They're doing a large report around increasing capacity to train nurses. And so that will be coming out in the next couple weeks to a month time period. And Office of Financial Management is bringing forward recommendations around improving nonprofit employer access to public service loan forgiveness. And then I'll leave you with one last thing just because it's important, even though it's 11. On the budget asks, this was already came up today, and there was a brief mention in the report outs about how challenging the credentialing environment is at Department of Health right now and how that does impact people's ability to transition into a role. Well, the thing to know is Department of Health has actually gotten more staff from one-tier funding last year that is helping them make progress. And so right now they're able to, for all the incoming applications that come each month, they're able to close or process or issue about the same number of applications. So they're kind of staying even, but there's still the backlog in there that built up during the pandemic. The funding for that additional staff support expires in June. And so if they have put in a request to extend funding for a further year for that additional staff work, because they're very concerned that that backlog will just continue to increase if they lose the FTE that was granted to them over this last year. So I just like to point this one out because it's super wonky, but when credentialing isn't flowing well, I think all of you can appreciate what a challenging environment that is for hiring folks. So I'm going to stop. The meeting goes to 11:30. I have it on as 11. What time do we ending?
It goes till 11. We're just wrapping up right
Oh,
now. very
okay.
soon. Yeah, no, you're good on time. Thank you,
Sorry.
Renee.
Someone
No,
DM'd me, so, and I got all confused. All right, so that's it. And I'll do better on my fonts next time. I don't know why those didn't come over to you guys. Thank you.
Yeah. All right, thank you, Renee. Really appreciate that. Just a few HILT announcements. We do have a lunch and learn that's coming. It's from the Imagine Institute. That's going to be happening on December 10th. Invitations will be coming out. They are an organization that really works a lot with early learning educators. And so it definitely is going to be an impactful conversation to see. Once again, don't forget, if you're interested in joining the Talent Pipeline Committee, that is the committee that supports the work that WOBS and the Student Experience Package that we work with. Please do join, and we'll be sending this slide deck out for that. Also, don't forget to join the LinkedIn Health Industry Leadership Table LinkedIn group. It's a great group for us to be sharing information. And then lastly, we also have the Echo. Echo is happening again in Snohomish. This is similar to the Sound Careers in Healthcare event, and we are supporting this event as a network. We're supporting it with volunteers, with opportunities for you to go and table if that is something that you're interested in. So here's the information that is happening in March 24th, 25th, and 26th. So that's going to be happening at Everett Community College, and they are reaching out to all the schools in Snohomish. So fantastic reach there and partnership with that Echo Tour. In addition, we are ending the year. We have one more meeting for this year. It's a support partner meeting that's happening on Thursday, November 21st. Please do register to attend. And then we're coming out with the 2025 HILT meeting schedule. That is coming out very, very soon. That'll be coming out the first week in December. Moving on to Tracy for any last comments.
I just wanted to say I find these meetings very helpful. I hope everyone else does. I thought the data that's available to us was extremely helpful. I didn't know it was out there. I hope everyone takes advantage of going out and checking it out. Thanks everyone for attending. And that is it. Move forward and conquer. Oh, quick reminder, donations for the Sound Careers. Just want to put that feeler out there. I know I've put a request in, so let's get us to that number.
Terrific. Thank you, Tracy. And thank you to everyone for joining. Have a wonderful week, and one day at a time. Have a good afternoon.
Thanks, James.
Thank you. And I will respond back to your email. My apology.
No worries. See you soon.